What are common ethical dilemmas in healthcare? Have you ever wondered what tough choices healthcare providers face every day? The world of healthcare is filled with ethical dilemmas that can challenge even the most experienced professionals. Let's take a closer look at some of these common issues. One major dilemma is the balance between patient autonomy and medical advice. Patients have the right to make decisions about their own care. However, there are times when a patient may refuse a life-saving treatment. This puts healthcare providers in a tough spot, as they must respect the patient's wishes while also wanting to provide the best possible care. Another significant issue is the conflict between confidentiality and the duty to warn. Healthcare providers are required to keep patient information private. But what happens when a patient's condition poses a risk to others? In such cases, providers must decide whether to breach confidentiality to protect those at risk. End-of-life care presents its own set of challenges. Decisions about how to care for patients nearing the end of their lives can be emotionally charged. Healthcare providers must weigh the wishes of the patient against their professional obligations, especially when the patient's quality of life is in question. Resource allocation is another ethical dilemma in healthcare. With limited resources, providers often face tough choices about who should receive treatment. This can include decisions about organ transplants or access to expensive medications, especially in emergency situations. Cultural sensitivity also plays a role in ethical dilemmas. Healthcare providers encounter patients from diverse backgrounds, each with their own beliefs and values. Sometimes, these cultural practices may conflict with medical recommendations, creating a challenge for providers who want to respect cultural beliefs while ensuring effective care. Informed consent is a critical issue as well. It is essential for patients to fully understand their treatment options and the associated risks. However, this can be difficult when patients have limited understanding of medical terms or are under stress. Lastly, healthcare professionals often grapple with conflicts between their personal ethics and professional responsibilities. A provider may have personal objections to certain treatments, but must still provide care that aligns with professional standards. These dilemmas highlight the importance of ethical principles such as autonomy, beneficence, non-maleficence, and justice. Healthcare providers must navigate these complex situations while maintaining their integrity. They often rely on ethical frameworks and guidelines, seeking support from ethics committees or peer discussions to ensure that their decisions align with both personal and professional ethical standards. Understanding these common ethical dilemmas can help us appreciate the challenges faced by those in the healthcare field.